Hello everyone. We're really excited to present to you the view from America, me and Sam from Reveal and Chicago Tribune. And really what we're here to discuss today is how we've been doing a lot of collaborations with scientists and academics. As journalists, we've been collaborating with them, and how we've been able to do some complex and rich stories because of those collaborations, and just share some examples and some insights into how we've done that and why we should do more of that. We want to start with just giving you an overview of based on some of the reflections we've had, based on some of the projects we've done, and start from there. We just want to let you know that we want this session to be very interactive, and we want this to be back and forth between you and us, and you don't have to wait till the end of the presentation to ask questions. If you have questions while we're presenting, let's just dive into a discussion, because we're compressing a lot of information in a very little time. So if there's anything you want to know while we're presenting, we're happy to have that conversation. We just wanted to start off with just thinking about, why academics or scientists and researchers should collaborate with journalists at all. And I think there are lots of common strengths and goals that both sides have. One is, commitment to accuracy and fairness, being independent, caring about social impact and positive social impact, and pushing the boundaries of what's known. And I think both academics and journalists are involved in knowledge production and pushing the boundaries of knowledge. And there are also some sort of complementary strengths that both of them have, that they can bring something to each other. And one of them is, academics are very rigorous, they're very scientific, they have a deep knowledge and expertise and skill with regards to data analysis and their own subject matter. They also have a very strong commitment to accuracy, and they have the ability to amplify research. And when you look at journalists, journalists are, connectors. They want to talk to different stakeholders, they want to talk to different people in the community. They want to focus, even if they're focusing on a beat, like labor or public health, they're talking to different kinds of people. They're talking to administrators, they're talking to officials, they're talking to people, they're talking to different kinds of stakeholders. And so they bring this holistic approach to knowledge. And then they obviously, newspapers have a large audience, but they also have the ability to engage with that audience and to know what they're thinking about and how they lend some sort of a voice to the audience, and so they can engage and connect with a large audience. And when you build on top of research, there's research, but journalists can present stories in interesting ways. And there's a chance for journalists to sort of influence research, because journalists are embedded in the community. They know how to make research accessible, and they know how to be on a beat for a long time. So when an academic publishes a study or comes out with a study, it's even if your study gets covered by the news media, it's usually a summary or like a 500-word article on one single day. But if you're collaborating with a journalist, there's an opportunity for your research and your issue to be covered over a long period of time, to be able to resurface that issue again and again and again from different angles and perspectives, because the journalist is committed to the research and the issue. So your research lives on longer and is able to make more impact. So these are some of the strengths and complementary strengths for both sides, academics and journalists. And Sam, do you want to?
I would add that there's just a cool factor to working across fields, for journalists to work with scientists. I don't know about some of you, but sometimes I get bored with my own ideas and topics. It feels like, well, I haven't really written about this topic before, but it feels like I have, right? But the chance to work with scientists in different fields, whether it's medicine or environmental researchers. That's really exciting. People who are attempting this. This is a fresh approach to journalism, and I feel sometimes like we're on the cutting edge of something. So I would encourage everyone to do it because it's fun and exciting, and as we'll talk later, you can get some huge impact, not only journalistically, but journalists can really contribute to science too, and that's really an exciting thing.
I think one of the things that I really wanted to talk about is, I think we need help here. Okay, great. So one of the things we really wanted to bring or talk to you today about is how Sam and I have different approaches to doing these collaborations. 2 or 3 years ago, we received, our organization, Reveal, from the Center for Investigative Reporting, received a grant to work on these collaborations, and they hired me and they said, work with academics and let's do some cool projects. And so my approach was, really, okay, how do we do these collaborations? And I actually ended up calling Sam, and he was one of the few guys who'd done these collaborations at that point in time. And I said, how do we do this? And Sam, Sam had a different approach to doing this because he was reporting on something and then he found a question and then an expert, and then he, made a research happen. I started off very differently. I said, okay, I have to make a collaboration happen, and what's the best way to do it? And then so I started talking to researchers in my particular beat, brainstorming for ideas and research questions, and the process, started talking to other people who had been doing some of this, and then decided to do my own projects based on that. So there's 2 different approaches to doing some of this. Do you want to add something?
Yeah, and I think we're all doing something new. Again, this is a new approach to journalism in many ways, and so there's no right way or wrong way, and we're sort of feeling our way as we go along. I think the important thing is just sort of, if you have an idea, just start doing it, because once you do it, it's exciting, it's fun, and you'll find that the next project is so much easier because you've got your feet wet, and people in the scientific community know you, and they begin to trust you, and the next project comes much easier.
Yeah, I think it's for me because, again, didn't have any sort of reputation, hadn't done this before. It's a cutting edge new thing. So it's kind of hard to articulate to scientists in terms of, why should we be doing this? And some of those reflections on, what do the scientists have in store for them? It was very important to pitch. And I'll be sharing some examples, and Sam will be too, about what we did and how we were able to do some of these collaborations. So let's move on to those case studies. I worked for almost a year on diversity and representation in tech companies in Silicon Valley, which is like a thing that's very highly reported about. And just want to start off by saying that these are some of the largest companies in the world. They're based out of Silicon Valley, but the products they make and the technology they produce is something that fuels the global economy. And I'm sure you know who these companies are. Everybody in this room, I'm sure, knows who Facebook is, or Google is, or Apple is, or Twitter is. But I wanted to ask, how many of you know who Salesforce is? Great. Gilead Sciences? It's a company bigger than Facebook, and they're based in Silicon Valley. And so are, 200 other companies, technology companies that actually probably touch our lives. I mean, if you've used Mint for, managing your finances, that's from Intuit. If you've used LinkedIn, that's based out of Silicon Valley. I mean, there's so many companies that you may or may not have heard of, or have used or have not have used, and you don't know whether you're using it or not, and they're all coming out of Silicon Valley. So I wanted to basically study what the representation in those companies look like in the US, because what we learned and what several people have been reporting about is that they have very poor representation of minorities and women, especially in the upper rung. I mean, throughout the companies, but very, very stark in the upper rung. And we learned that every company in the US which has more than 100 employees has to submit a page. It's a one-page document to the federal government every year saying this is who works for us. You know, so many men, so many women, so many white men, so many white women, black women, whatever, and all of and by job category. This is where all of the white men in our company work. They work as executives, managers, or professionals, as admin support, and so they had to give out this data to the federal government. And usually when the federal government has data, you know, in the US, you can file FOIA requests and Freedom of Information Act requests and get it from them. But for this case, it wasn't, you know, the federal government tried to protect or tries to protect companies and says that information is actually a trade secret. So it's very hard to get data on diversity and representation in tech companies. And so we were sort of struggling on how to get this data. So the first thing, this is how the form looks like. This is Google's EEO1 that I was talking about. So Google has to prepare this document, send it to the EEOC, or the federal government, the Equal Employment Opportunity Commission. And when, you know, the Equal Employment Opportunity Commission sees this page and they say, oh, Google has no women of color executives, you know. If you look at black women, no black women executives in 2016. No Asian women executives in 2016, and they say, okay, this is what it is. Then they you know, look at this data for thousands of companies and they try to see what's going on there. And Google actually, for your information, releases this publicly. Google, Facebook, and some of the companies do, but a lot of companies don't. Oracle does not, Tesla does not, Netflix does not, Pandora does not. So some companies release this data and some don't. And so we did the first story, and this had no academic collaboration component, but what really happened is we prepared a list of the largest tech companies based out of Silicon Valley, 200 of them, and we wrote to each single tech company and we said, can you give us your EEO1 forms, that one-page form that you're required to submit? And 16 companies, like including Google and Facebook, were already releasing it publicly. 7 companies, Pinterest and Square, and some of those companies gave it to us for the first time. But a majority, and it was still 23 out of 211. So we still had only 23 companies that was releasing this data. Most of the companies kind of said, no, we don't want to give that to you. So we asked 211 companies, and the first story was about, you know, analyzing the data from 23 companies, which is not a lot, but also really reporting about the reasons people were giving to not release this data, or the excuses they were making. For example, this is Udacity. How many of you know Udacity? Oh, cool, great. So Udacity published this blog post, and you can see they published this blog post in 2015, diversity here, there, and everywhere. And in this blog post, they actually write they're very committed to diversity, and they're going to release their diversity statistics in a month. And we did our story in 2017, and they still hadn't released anything. And so we asked them, hey, what happened? You made this public claim in 2015. And their PR person said, yeah, we've just been really busy. We've been growing as a company, and so we didn't have time to do this. So we've had this, you know, reasoning from many companies. And our first story was just about the lack of transparency about this issue. And then, you know, we analyzed the data that we did have from 23 companies, and, you know, you can see we ranked the companies on by job categories, professionals, managers, all employees, and we ranked the companies by race and gender. Another thing that was happening was, even if companies were giving some data out, they would say, you know, our interns are very diverse, but what about the rest of the company? Or they'd be very selective about what they presented. Or they would say, we have 10% black employees, but what about black women? You know, what about the intersection between race and gender? That wasn't there. So there was a way they were controlling the narrative, and we said, there's this one form. It has issues, you know, this form is not everything, but there is this one form you're required to submit to the federal government. Why don't you give it to us? And there was just a lot of resistance. So our first story was just about that resistance, about the issue of transparency. And then, you know, we made a very simple news app with all the companies that we contacted, and what is their valuation? You know, is it a publicly owned company or a privately owned company? And then we said, have you released this data or not? That was the first. And then the second story that we,
one question about that. So, if I understand correctly, like all of those companies would be required to actually publish that, but you only got the data from 23 out of 100 or something, you said, right?
No, they're not required to publish that.
Or like at least give it to the government so you could ask with the FOI request.
Yes, but there's a catch there. So the government actually says that it's a trade secret. So there are two agencies. There's the Equal Employment Commission, Opportunity Commission, and they were supposed to give this data to, and then that EEOC is required by law to keep it confidential. And then there's the Department of Labor that has access to this data, especially for federal contractors. So Google is a federal contractor, you know, Oracle is a federal contractor because they do work for the government. So they have contracts for the government. So the Department of Labor actually has this data that they would go and ask. So when we filed for FOIA requests with the Department of Labor, they would actually go and ask those companies, is it okay if we release this data? And the companies would be like, no, it's a trade secret. We don't want to say how many black women are working for us. It's a trade secret. They would come up with like very silly reasons. And I'm going to get to that. We're actually suing the Department of Labor. So we have a lawsuit against the Department of Labor alleging that we don't buy that reasoning, and that there's no reason to not give us that data.
Okay, and I mean I really like the work, but if I was like in the seat of a PR person, then I would know like, okay, our company actually is really bad in terms of numbers and diversity. Like the best thing to do is probably not give you the data, because what happens now is like you write about the fact, okay, certain companies haven't, but it's maybe like one paragraph that I have to deal with, where for all those who are at least to give like so open to give you the data, they get it visualized, you can go into depth, and they look even worse, even though they actually made a step forward and say like, okay, we have a problem with that, and here's the data.
I think it depends on whether you want to be a company that cares about this issue or not, because I think in the long term, even if in the short term, I'm going to be a hard journalist, and my job is to, push for transparency and obviously grill you if you have bad scores. But I think in the short term, it may not work for you. But in the long term, I think if you improve, your numbers improve, you establish yourself as a person who cares about diversity, a company that cares about diversity, you're able to attract better talent from those communities. You're able to make better products because there have been tons of researchers making the argument for why diversity and representation is important.
I totally agree with you.
I get the PR person's perspective, but it's a short-term perspective, and you lose out on what you could be in the long term. We've had that with lots of companies who look bad, and lots of companies who look bad and don't disclose and end up disclosing anyway. Moving on, but that's a great question. Moving on, yes, so we filed freedom of information requests, we asked companies, but then we also found an academic, and this is the interesting part for you guys, is that we found an academic who had access to this data because he had a special contract with the EEOC, and all the companies were submitting this data to the EEOC. He had special access, and then what happened is that he said he could give us this data, but he wouldn't be able to plot the companies. So he wouldn't be able to tell us which company had what numbers, but he was able to give us, he was able to anonymize the data and give us that data. So we worked on that. And then we did the second story. We co-published, so we revealed a story. And the academic co-published a technical report. And he also ended up writing for the conversation. And the interesting thing is, his report had only anonymized data. Our report had the anonymized data, which was the distribution of 177 companies, and that never happened before because our first story had 23 companies. So this next one, we were able to see the distribution of the numbers for 177 companies, even if we weren't able to point out which companies were what. And on top of those 177 companies, we were able to plot or rank the 23 that had released their data. And we were able to amplify that message in different ways because this conversation piece the academic was able to use our analysis of the ranking of the companies and write about it, and we were able to use his data, and so it had different audiences and platforms, so we were able to amplify it in different ways. The other great example of this is how journalists can actually make things very interesting, and they don't have to, and there's value in storytelling in an interesting way. So actually what we did was we took this data, some of this data at least, a part of this data, and we said we want to go to a church choir, and we want to help the church choir sonify that data. So let's say, you know, a Silicon Valley company has 40 executives, and let's say 70% of them are white, or 70% or 80% of them are male, and 20% of them are female. What we did is we said, out of you 40, 80% of you 40 would like saying male executives, and the 20% of you 40 are going to say female executives. And so we found a way to use this data for a radio. So I'm going to just play some stuff, so it's easy, so we can enjoy some of this, and hopefully we don't have to listen to ads here. Okay, this is male versus female. How many male executives versus how many female executives in the percentage in a tech company on an average?
Du, bist du eigentlich romantisch?
Klar. Wenn zum Beispiel im Stadion das Flutlicht angeht.
Premier League hautnah erleben mit DFDS. Zum Beispiel mit einer 4-tägigen Fußballreise nach Newcastle. Schon ab 169 € pro Person. Inklusive Fähre, Hotel und Matchticket für Newcastle United. Für mehr Infos jetzt den Banner klicken.
So let's listen to this again. That's like the men drowning out the women.
Microwave cooking unit.
Okay. Sorry for this. Okay, let's see if this works. Black Do you want to listen to this again?
Microwave cooking unit. R&D revolutionary.
Okay. The third piece was, you know, the previous one was about men and women and by race. You know, you saw one person singing black executive. It was actually less than 1% actually. But we didn't want it to be 0, so we had one person singing Latina executives, maybe 20% singing Asian executives, and the rest of them were white. We wanted to do something very interesting with Asian women. And basically with Asian women, you see that, you know, there's a significant number of Asian women in the professional engineering world, and then fewer in the managing world, and then very few in the executive world. And so we mapped these voices. They would just thin down, you know, from professional, so you can hear their voices thinning down on this. And I hope we don't have.
Microwave cooking unit. R&D revolutionary.
You sold ads for his presentation.
For a main course, how about a delicacy like lobster tails? Ready.
Okay, cool. That's good.
I have to say, when you showed me that last night, I was really blown away. The idea of sonifying data. I mean, how did this come up? This idea for you to do this?
You know, we had a radio show. That was the first motivation. We wanted to present this data on radio, and we didn't want to be bogged down by just the numbers, because you can say the finding, it may not be impactful, but when people can hear it, it can be impactful. And then we had an audio engineer who came up with the idea of, we were broadly thinking about data sonification, and there are lots of programmatic ways to do it, but he came up with the idea of, if you can get us these particular numbers of averages or then we can actually go to a church choir and do it this way, and then the whole newsroom came together.
So you just went to any church and just said, will you sing?
We went to his church.
Yeah.
The First Unitarian Church at Oakland. That was his church, and so he knew the church manager, and we hired the room for an evening. We had all the Reveal fans show up to the event because we wanted people to sing, so it was all volunteer based. It just happened. And then lots of missionary. Sorry for the technical, the ads. And then moving on. This is a visualization we did. Again, the point is, you know, that when our academic heard these sonifications and looked at these visualizations or in these apps, he was blown away, because I don't think he was thinking of presenting that data in this accessible or interesting format. And that's a huge, huge advantage for collaborating with journalists, because they can take a story or completely understand an issue and then make it very interesting for the audience and easy to understand for the audience and inculcate interest. So this is how we looked at the distributions, and we had an app, and these are 177 companies, and then we were able to create a small app where you could look at executives, managers, by company, or and then the orange dots were basically the companies we knew, whether it was Apple or whether it was Nvidia, or where are they? Are they like below the median of the industry, higher than the median of the industry? And these were things we knew only because the benchmarks were established only because we had this data from the academic. And we published, the methodology. So I know we spoke a little bit yesterday about the importance of being transparent. So lots of little things and decisions we made. We, published the methodology. We published the data. So it's open access and transparent. The data we acquired from the academic, the processing we did, everything's documented. And Sam spoke about impact. I think when you have this sustained sort of effort with collaboration, with long-form reporting and investigative journalism, you can really make a lot of impact. A lot of these companies you might know of, they're not small companies, Pinterest, Slack, PayPal. Many more that I haven't even put here, they all started releasing their data, and somehow the PR people were okay with doing that, although NVIDIA's numbers are probably in the bottom, and so is View's. But I think it led to this awareness of wanting to be transparent, to be leaders, to have a chance to improve, so that only when you're transparent and you're held accountable can you improve. Otherwise, you're not going to be able to do that. There are still lots of companies that don't release it, and we're on the topic, so we hope they do in the future. We've come a long way from 14 to 16 companies to around almost 41 now. And the fight is still on. We've sued the government for Silicon Valley diversity data, and stay tuned to knowing following that lawsuit, that FOIA lawsuit, to see what happens. But I think we think we have a good case. And we don't believe that this number is a trade secret. It may not make you look good, but it's not a trade secret. And I just wanted to highlight another case study that the New York Times and the Measure of America did when it comes to studying high school graduation rate. So the New York City had done some reforms in which students from poor neighborhoods could apply to any school they wanted in the city. And on paper, that sounds really good because, I may be in a poor neighborhood, and I may be, the closest school next to me may not be very good. But what if I could apply to like a really rich, a school in a really rich neighborhood, or in a suburban neighborhood which was really good? And did I have a shot at graduating and a bright future? And they looked at this question. And Measure of America, which is an arm of the Social Science Research Council, applied for the data from the New York City Department of Education, and they did the data analysis of high school graduation rate. And then this data was, a research report, and it was also a New York Times feature story. And they were systematically able to prove that some of these even though there were lots of education reforms, the disparities continued to stay. Mostly because, on paper, a kid could apply to any school, but the schools had criteria for accepting students. The schools were far away and students needed access to transportation. So there were many reasons why what worked on paper didn't translate into a better life for kids. And the New York Times in this collaboration, the reason I wanted to mention this case study and this collaboration is because more things have been happening in the US. Many collaborations in small and big forms are happening. And the New York Times, again, brought some very good human elements to the story, data visualization to the story, added to the data, had characters who were able to exemplify what the data said, and the Measure of America was able to apply for the data and they analyzed the data. So the New York Times was able to use that and build something on top of that. So this was the New York Times story, and this was the Measure of America report. Again, the New York Times was able to do very different visualizations than what was in the academic report. And this is the first visualizations about the point of where the schools were and how much commute time was required and what were the transportation needs. The one on the right is about the different poor neighborhoods and where the schools are in relation to that, and how some of the schools were really highly selective. So even if the kids would apply for it, they may not be able to get through, or there were other processes and problems because of which the kids were not able to get through. So things really didn't change. This is what they were able to prove. Again, another visualization illustrating the same thing. Mostly proving that kids usually went to the schools in the neighborhood. So if you are in poorer neighborhood, then you don't go to the best school possible. And even if you have options open up, there are many barriers. And I wanted to highlight about another thing that's coming up. We have more projects in the pipeline that truly come out of these collaborations. We also have an event called Mind to Mind that I'm organizing and Reveal is organizing in collaboration with American University and the Investigative Reporting Workshop. It's happening on October 12th. And the whole conference is about bringing academics and journalists together and focused on the workforce and the labor market. So you're all invited to attend. And now I'm going to pass the baton.
I had a question on your work on the diversity. Have you received any feedback or any evidence that any of those high-tech companies are actually increasing hiring and to make their workforce more diverse because of your article? Has that put any pressure on them? Have you seen that, or is that too early?
We have to, I think, I don't want to take credit for all. There's a lot of effort amongst tech companies to be more diverse. I would say we can't take credit for all of it because, lots of newsrooms have been writing about this, and this is an issue that has been there for decades. And even with respect to transparency and asking them to be more transparent, I think Reverend Jesse Jackson, has been on it. Other newsrooms have been on it. We are not the first ones to apply for FOIA requests either. Lots of us have been pressurizing it. We are seeing at least more transparency or commitment to transparency. They've always said that tech companies have been saying for a long time that they care about diversity. So now I think it's about the nitty-gritties of you're saying it, are the numbers really improving? And the improvement has been very slow. But I think the needle is moving, but it's very slow.
Just really quickly, I've been wondering about the legal question about scientists giving you data that US journalists are technically not allowed to have. Because I think we talked about this yesterday or the day before, that often if scientists get access, they're not allowed to give it to other people, including journalists. So was there a problem, or is it just no problem in the USA, or did you think about that?
I think it varies case by case. I think it's very important to see who the academic is and how they're willing to collaborate with you. I think even before we did the first story, even asking companies to release this data, even at that time, the whole idea of wanting to report about this issue came after a conversation with the academic. And he had a relationship where legally he was not allowed to give us any named stuff. Mm-hmm. but he was able to give us anonymized stuff, which we followed throughout, and then we independently analyzed the data. So this report doesn't name anyone, and ours does. So we were able to say, some company has very poor numbers on gender or racial diversity. He wasn't able to say that, and he didn't. He gave us the anonymized data, and I think it's a case study of how you can report on top of what an academic did. His hands were bound in terms of what he could do in terms of naming and ranking the companies, but we could do that, and so we built upon the data that he gave us. But yeah, everything was legal, and he didn't have any legal issues releasing the data that he did. He would have had issues if he had named all the companies, which he didn't.
Thank you.
I'm going to switch over.
Yes. No ads.
I should, I probably should have mentioned this in the beginning when we first came out. I want to thank the organizers for putting this conference on and for having us here. This is a wonderful conference. I think it's very important at this time to have this kind of gathering because, as you know, in the United States at least, journalists and scientists both are under attack like never before. Journalism in many ways is struggling to find its voice and its identity. With Trump as president, Trump is called the media the enemies of the people. I mean, the enemies of the people. I think that's more reckless than anything any journalist has ever done or said. For having the president of the United States say that. There's a real anger in the United States against the press. Our newspaper is owned by Trump. We own a lot of newspapers across the country. One of our newspapers in Maryland, back in June, a gunman walked into the newsroom. He was angry at the newspaper. He opened fire and he killed 5 people, including some journalists. So now when I go to work, there's added security, and there's concern. So that's one view of America that we bring you, is that there's concern. But the other view from America, I think, is we have some optimism because I think this is a chance for us. When we fight back against our own president, it's not by getting angry, it's by strengthening our identity as journalists, that we're people in a profession that seek out the truth. And we deal in facts. And we're an evidence-based profession. And if we can try to do more rigorous research, if we can work with scientists and we can deal in facts, then that's going to strengthen our identity, and I think that's going to make everything so much better. So I think even having conferences like this, even attending this conference, it helps. It really, anything we can do to improve that identity is going to really help. So thank you for having this, and thank you for being here. So I was lucky enough to be here last year, and I talked with a medical professor from Columbia University. Could you raise your hand if you came last year and sort of heard me? Okay, a few of you. So I wanted to zip through that quickly for those who haven't heard it before, and then tell you what we've done since and how we built on that project, working with academics, and what's come of that, and some very fantastic things that are going on at Stanford University. So this photo here is actually the team that we had collaborated with at Columbia University. This is work that is still ongoing at the Chicago Tribune. We spent over 2 years, takes a long time, unfortunately, looking into harmful prescription drug combinations and safety problems at U.S. pharmacies across the country. But we had a lot of academic partners. We had the journalist team at the Tribune in Columbia, University of Arizona, University of Washington. And what we were looking at was prescription drugs, but what I'm really sort of proud of the story, maybe we were lucky, but we had a lot of results. And this is what I love about collaborating with scientists, is that you can get results not only in journalism to do things to help the public, but there were scientific results. We had 2 scientific papers come out of this work. We had discovered previously unknown dangerous drug interactions And we had some traditional journalistic results, that there were safety reforms at U.S. pharmacies, and there were new health laws put in effect because of all this work. And I don't think that would have happened if we wouldn't have had the credibility of working with scientists. And I'm not sure the scientists would have had scientific papers if it wasn't for the journalistic effort too. So it was really pretty nice collaboration there. This area is ripe for collaborations. If you're a journalist, you're a data scientist, the field of medicine, prescription drugs. There are so many pharmacies now around the world. They're iconic businesses in the United States. 20% of all Americans take 3 or more medications. That's a lot of drugs. It touches everyone's lives. And as an investigative reporter, I was interested in this because you can't pick up the newspaper without seeing some scandal regarding a pharmaceutical company or some health effect involving medications. And I was interested in the idea that a lot of these medications, if you took them together, could harm you. We know that if you take one drug, it could be relatively safe for you and not have any side effects. You could take another drug, won't have any side effects. But what happens when you start taking multiple drugs? Does anybody really know that? Well, the answer is yes, some people do know that answer. There are some medications out there that are well-known, have well-known drug interactions. Your doctor may warn you. But because there are so many medications out there, it's impossible to know all the different side effects when you start taking them together. And we knew by logic that there were these hidden risks out there that maybe no one had discovered yet. And so I was interested. I mean, could we discover our own drug interactions? And so that was sort of the question I had, and that led me to the scientist who was here last year, Nick Tatnetti, of data scientist at Columbia Medical Center. He was working on some really cool, novel data mining techniques to try to determine what the effects of drug combinations were. And I went to him and I asked him that, you know, I'm really interested in this topic, and I'm interested in drug combinations that may cause some heart failure. Can you use those cool algorithms you're working on to help us discover that? And he said, yeah, I think so, but I don't know much about this heart condition you're talking about. And I said, well, I do. I know someone out in Arizona at the University of Arizona, and he can help. And he said, yeah, if you get that guy, that would be fine. That would be great. So we sort of formed a team. And I think it might be the same with your team. When you form a collaboration with academics, you don't say, hey, let's form a team, we'll get t-shirts, this will be fun. I mean, it was more like, the collaboration that word never came up in all the time we were talking. It was, we were united by this common question, is could we find something? Could we discover something no one knew about? And the answer was maybe. He thought maybe this would work. His data mining techniques were latent signal detection, where he was actually looking at data that didn't seem to be there. And how he got there was we first looked at the US FDA database of drug complaints. When someone had a problem, they would complain to the FDA. But when we looked at the database, there were no examples of people complaining about taking certain medications causing this heart condition. But that didn't mean that it wasn't happening. It just meant that maybe people weren't reporting it. So what he did through latent signal detection is he looked for signals or signs that maybe something was out there that we couldn't visibly see. And the analogy that he liked to use was it was sort of like astronomers looking for a black hole. You can't see a black hole when you look in the universe, but you can tell it's there by the side effects around it, like stars being swallowed by a black hole. So when he looked at the data, he analyzed a constellation of side effects to see if that would signal that there was something larger going on. And at the end, he would make predictions of what might be happening in terms of drug combinations. So it's a lot of guesswork. So when we finished, we had hundreds and hundreds of drugs that seemed to be causing this potentially fatal heart condition. But it seemed like there were so many responses. The data gave us so many results that it seemed almost meaningless. So here's the really cool thing about working with academics. You can validate your work. Because I was able to collaborate with the folks from Columbia Medical Center, look at the access to the records they have. I mean, this is something that journalists don't have access to. They had 4 million patient files and 300 million lab results and billions of clinical, I mean, this is like extraordinary. And this normally is private information. And I could sit down with him at a computer, and I didn't have access to it. As a journalist, I couldn't just start typing and start querying and asking questions of this large medical archive that was private, but he could do it. So we could brainstorm, and he could say, yeah, I can ask the computer that. And so what we were able to do is we took all those initial results, much of it could be noise, and we were able to validate it and see what was really happening with patients that were coming through the hospital there. And what we found was, if you took the data mining that we did, and you took the hospital records we had access to, that really only boiled down to 4. There were 4 drug combinations that seemed to be affecting people's hearts and causing them to die. And this was really exciting. And I think we could have stopped there, and we could have moved on, and they could have written a scientific paper, and I would have had a good piece of journalism. But the scientists wanted to go further. They thought, well, is this really true? It's still just sort of based on data science, and is that enough? And so what we did, it would be super expensive if we had to pay for it, is we went next door at Columbia Medical Center, where they had a cellular research lab, and we tested individual cells with these drugs to see if the drugs would affect the cells, and they did. And so that gave us a biological explanation for our theory and our work. And so we felt confident at that point that what we had discovered was real. And what I thought was really cool about this project is that you had data science that came together, that went all the way to the end, where you went into a lab and you did traditional science. You did lab work to validate the analysis you did of the data. If we didn't pay for any of this at the Tribune, right? The collaboration, it's like they did it out of the goodness of their heart because they really liked the idea. Obviously, the Tribune is paying our salary, the reporter's salary. If we would have had to pay for the cellular research, it would have been in the hundreds of thousands of dollars. This is really super expensive to do. But it's one thing that helps is that if you have an idea that everyone is sort of behind and interested in. So that's, last year when I was here, I went through and I talked about that and the beauty of these collaborations. You have all these fields working together: journalism, data science, medicine, pharmacology, cellular research, lots of different folks coming together. I thought we were very lucky that nothing major went wrong. It took, there's ups and downs where you think maybe the project is not gonna come through. If one person on the team decides they're gonna quit or leave, or they don't wanna work with you anymore, that could be a real problem. Luckily that didn't happen.
Sam, here, I'm very curious. It's really hard working in teams, even within the newsroom. And this has lots of different people from lots of different fields. So can you tell us a little bit about the ups and downs, like any up that you can share, or any down actually?
The ups were any time we all got together and actually, seemed to make progress. Because when you have teams from different fields, sometimes it's just hard to get people in the same room, or the schedules. There's a lot of logistics. It's like traveling. There's a lot of logistics of getting from point A to point B, and you think this is horrible, I'm never going to travel again, and then wow, you see something amazing and it makes it all worthwhile. It was sort of like that. I was going back and forth to New York a lot because I was sort of managing the project. That was sort of my role as a journalist, and I felt I couldn't do it virtually, I couldn't do it on the phone, and I had to be there physically. I think that kept everybody on track, and that's the one tip I would have if you're doing a collaboration with journalists, that sometimes you just have to sit down with your partners face to face, because if you have a meeting schedule on Tuesday at 2 o'clock and everyone gets together, Tuesday morning you're thinking, I promised I would do this, this, and this, and I hadn't yet. And so everyone would, rush to do this work. As far as the downside, you know, the length to do these stories was difficult. You know, sometimes you would go weeks and months without really making much progress because of, you know, there'd be one team member that was on vacation or they couldn't do something. And my boss would say, why is it taking so long? Why can't you tell them to just speed up? And I said, they don't work for us, right? It's a collaboration, they're not our employees. I mean, and so everyone has to sort of understand that there's not a boss, right? When you work across, and you might have run into this, there's no one really in charge, right? So everyone's doing it because they think it's the right thing to do, and oftentimes that can get pushed back, right? When you are actually answering to a boss with something you have to do. This was something that we were doing on the side.
I think you become like a project manager apart from a journalist, because this whole thing is like on you, just like, you know, you're like coordinating and managing and setting deadlines whether people follow or not. And I think that's just, you know, I didn't envision myself to be a project manager, but I was becoming that, I guess.
Yeah, and I had probably more at stake in it as a journalist because I was getting paid by the Tribune to like produce something.
Mm.
And these scientists were doing it because it was sort of a side issue for them, right? I mean, they were working, they were spending a lot of hours on it, but they were also teaching and doing other research too.
Sorry. Can you just explain a bit like about like how you communicated that with your boss? Because obviously that's one of the big problems you have. I think all of us would love to do much more bigger, deeper investigations, but then for right reasons, like your boss comes to your desk and says like, hey, you haven't showed up with an article for 2 months, what's happening here? So how do you struggle with that?
I get defensive, I get angry, I quit. That's the $1 million question in journalism. I think the secret is that to be an investigative reporter, you always have to have one foot out the door. I hate to say that. Your boss is your story, you know, and there's going to be many, many times that your bosses aren't going to like you, and they're going to be frustrated with you, and you've got to accept that. And I go home sometimes and I get, you know, you want to be liked, and I say to my wife, I go, God, these are my bosses, they don't like me, and she goes, you don't get love from your bosses. You get love from me and your children and your family, not from your bosses. But it's hard, you know, and so you cross your fingers that everything's going to work out, and you stay positive. You always have to stay positive, even if things are going down. You can't come back in the newsroom and say, oh, the scientists aren't coming through, because everyone will, you know, panic. And so you've got to always stay positive. We have a great story. It's going to come together. It may take a little longer than you think, but it's in the end, it's all going to work out. And you really have to be the main cheerleader of your project.
I think the other thing that's worked for me is, you know, I'm also working on another project which is taking much longer to come through, is you have to keep doing other stuff to make sure there's something the editors are happy with. So it's not one thing that's taking 5 years, but you've produced all this other stuff, but you're also spending time on this project of yours, which can have huge impact. And you know, if something takes 2 years to come together, it's going to be meaningful and impactful. So, but you can always have smaller stories or other things up your sleeve, and so everything's not centered around this main project. But I think that's how I've seen it.
So what would have happened if you didn't find that connection between the drug combination and heart disease?
I'd have to get a new job. I don't know. I mean,
that's right. Sometimes you really think you have something, but still.
Right. I mean, we had talked about that. We thought if we didn't do the cellular research, we could have stopped there, and we could have had a pretty strong story that based on the data search and the medical records, this seemed to be happening. Right, that would have been okay, it would have been perfect, but the cellular research made it, yeah, this is happening. And it turned into a scientific paper in a leading cardiology journal, so it became real. But that was a little risky journalistically to, I think, do that. And it took a long time. That set us back like 6 months. But part of the problem is that the scientists wanted to do that. They were really firm on let's do that. And so I had to go back to my bosses and say that we have to wait. I mean, our partners say it's absolutely important to wait. So I was able to wait enough, get more time. So one thing we did to follow up on that work is I was interested in pharmacies in America, and as I mentioned before, they're on every corner, you know, CVS, Walgreens, then a Starbucks, then a Target, then another CVS, and I mean, they're really part of our generation. Like in my parents' generation, it was Ford and GM and Chrysler. And in my generation, it's Starbucks and pharmacies. You go to pharmacies not only to get your medication, to buy shampoo, to buy stamps, to buy clothing, and they're everywhere. And yet their core mission is to protect you from any harm of medication. You have to go to a pharmacist to get your medication, and it's a very important job. They're a very important cog in the medical community. This is why we don't get drugs out of vending machines. We have to go to a medical professional. And yet there's very little scrutiny on what pharmacists do and how well they do it. And I thought that our knowledge of drug interactions could give us a rare opportunity to test pharmacies to see how well they're performing. Now, as I mentioned before, there are many drug combinations that are well known, that an average pharmacist should know about, right? So but we wanted to test that. Would they really know if we went into pharmacies and asked them for these drugs? Now, this was sort of an odd idea that reporters walking into pharmacies and asking for, you know, a dangerous drug combination. I couldn't go in there and say, yeah, I'm Sam Rowe from Chicago Tribune. I would like to get these 2 dangerous drugs. You should warn me and not give them to me. I mean, we would have to like do an undercover operation. And I was against that. I was really queasy about doing something like that because I felt as journalists, you know, job one is to always tell people who you are and always be transparent about what you're doing. And so I was sort of against it. But there was a lot of debate in the newsroom and the other reporters I was working with, and I sort of came around. And I think what changed my mind about doing some undercover reporting on pharmacies was that maybe we don't approach it as journalism, maybe we approach it as science. What if we did a scientific study? What if we did it so scientifically vigorous? We had a methodology that was so sound that we were actually creating science and then turning it into journalism. Instead of approaching it as a journalism story with science, with a scientific element, we were going to do science. And if it worked out, then we'd make it journalism. So that sort of swayed me. And so what we did is we contacted our colleagues at the University of Arizona and said, if we did this, if we went into pharmacies and tried to see if they would know anything about drug interactions, what drugs would we ask for? Because that was just starting point. What would we do? And so our colleagues at the University of Washington, University of Arizona, after long debates, which I won't bore you with, they came up with 5 drug pairs that should never be given together. That if you went into any pharmacy, you know, here in Dortmund, the pharmacist should not give these medications to you together because they could potentially kill you. And these were no-brainers. You didn't have to be a seasoned veteran pharmacist to know this. This is something you should learn in school, and even the most inexperienced pharmacist should be able to catch these. And so our question would be, if we went in and we asked for these 2 drugs together, would they catch it? Would they warn us or not, or would they just give it to us? So we thought, okay, we have our drugs. What we really need, and the tricky part is we need some prescriptions, right? I can't go and just ask for drugs. You need a doctor's order. How am I going to get a doctor to write prescriptions for me and all my colleagues at the Tribune helping me for drugs we don't need? Who's going to do that? And I thought, oh God, this is going to be so difficult, right? If I was a doctor, I wouldn't do it. Am I going to get in trouble? You know. And this is where it helps, I think, to have a track record of doing some collaboration with scientists. So I actually struck out asking a couple doctors in Chicago, but there was this other doctor that had an experience in this area, and I sat down with him, and one of the first things I did is I showed him the team. I showed him the work that we did, the collaboration with Columbia, and all the extent we went through. And so we even did cellular testing, right? I mean, we were really serious about doing science. And so I think that eased his fear that we were going to take his prescriptions and then get a bunch of drugs and sell them, or do something crazy like take the drugs. So I approached it not like, will you just help us out do this story? I approached him that we're doing scientific research, it's going to turn into journalism. Can you join our team? Right? We're forming a scientific team. We have these scientists on board. We want you to be part of it. We can't do it without a physician here in Chicago to write these scripts. And he didn't blink. He said, yeah, sure, I'll do that. So, but I do think it helped to be able to approach it as a collaboration involving scientists.
So I'm also seeing that he's, a geriatric and disability medicine doctor. Was that a consideration? Because as you grow older, you have many illnesses or many things happening simultaneously, and then you might have to take many medicines. Like when you're younger, normally you would be in a situation where you have to take 3 or 4 medicines every day. So was that background of his an interest or an influence in why he was?
Yeah, he actually was interested in this topic because he had a lot of senior citizens as patients, and he saw the dangers of drug interactions firsthand. Mm-hmm. Especially people who go to nursing homes. If you have any relatives in nursing homes, you'll see a long list of medications that they're on, and there's very little attention paid to all the side effects that are coming from those medications. Sometimes there's a medication, often there's a medication that you're given to deal with the side effects of the first medication. There have been some studies suggesting that if you took a patient off all the medications, they might actually do better. So he was really interested in this topic in the first place, and that's why I came to him. And so he not only, you can see my name on it, sorry, the slide is sideways. You wouldn't be able to read his handwriting anyway because he's a doctor.
So is it legal to prescribe something for a disease that hasn't been diagnosed? I'm just still wondering, sorry.
I think the question here is it legal for him to write a prescription for a patient who really doesn't need the drug? That was our ethical issue. And so we did a lot of research. We sat down with our lawyers, we did legal research, and we came to the conclusion that it was okay. It was a gray area, but there is some precedent for this happening. Pharmacy schools sometimes send out actors, literally hired actors, as what they call standardized patients, to go into hospitals to test to see if doctors will catch diseases and things of that nature. So what we were doing was sort of pushing the envelope journalistically, but it was fairly common in science. And so I think the editors and our lawyers were convinced that what he was doing was legal. If anyone came after the doctor, that he would be okay, because we were doing this for research purposes. And we also had in our methodology that when we walked into these pharmacies, and it was just not me, it was 15 other Tribune reporters, we had these prescriptions that we would never mislead anyone, beyond the fact that I wasn't actually going to take the drug. So I would walk into a pharmacy and just hand them the prescriptions, and I would use my real name and my real address, and if that's how old I was, I would tell the truth. And so any question they would ask, I would tell the truth. I would never mislead them. And we were nervous about that, because we didn't know the very first test we had was, hey, Sam Bro, you're the guy from the Tribune, right? I mean, right? We didn't know what was going to happen. But if you've ever been to a pharmacy, at least in the United States, there isn't much conversation. It's like going to McDonald's. You walk up, I have a hamburger, fry, and Coke, and boom, you pay and you're out. I mean, that's why pharmacies are really popular. They're built on speed. No one wants to answer a bunch of questions when they go into a pharmacy with a drug. So we would come in with these prescriptions, we'd hand them over, and they would ask us one question, basically. Are you going to wait for it, or are you going to come back? And I'd say, I'll wait, and say, okay, 5 minutes. And 5 minutes later, I pay him out the door. And so we were nervous about doing this, but that really we never really had a moment where we felt the test was going to be exposed. And we had so many people working on this, going not just in the Chicago area. We went to 5 states in the Midwest to do this test because we wanted to do a whole number of tests. And this was part of the problem that we found, that there is no conversation, that is treated like fast food, and medications that could kill you should not be treated as fast food. So we would get the medications back. Oftentimes they wouldn't ask anything, they'd give us no warning. We would buy the medications. I couldn't just leave them in my car or whatever, so this was the filing cabinets near my desk at the Tribune, and we would carefully collect them. As a social scientist would, we had a chain of custody form where we bought them, what was said, how much they cost, was it a pharmacist who checked us out, was it a technician, if there was any conversation at all, we recorded all this. When I eventually got rid of the medications, I couldn't just flush them down the toilet. You're not supposed to do that. I had to take them to the police department, just boxes and boxes of medication, had to drop them over to the police department. These bags and the other information, I just recently, in the last week or so, sent them out to the University of Arizona because they're going to do an additional scientific paper on what information a pharmacist does give you. You know, besides saying, have a nice day, what else do they put in that bag, or what else do they say to you? So the results were really, I think, somewhat startling. 50% of the time, these pharmacists gave us the medications without warning at all, without anything. You see that in the middle, 50%. The pharmacy that did the worst was CVS. That is the #1 pharmacy in America. By chain, by size, they did the best. What really helped me as a journalist is that their main competitor, Walgreens, did the best. Still a horrible score. I mean, 30% of the time they didn't warn us. But what helped as a journalist is that the #1 pharmacy company is doing the worst. It helps when I would go to them and say, you're really doing bad. What are you going to do about it? Your main competitor is doing much better than you. And so what that did is CVS was backed into a corner in many ways. So they announced that they were making reforms across the country in the way they did things. So they were changing many things because they almost had to, because this is such a competitive environment.
Can I have a technical question? So what would be the way for the pharmacists to know that this combination is not, they check in the computer, or they need to?
And both. So they should know this. We wanted to pick ones that were so easy. We didn't want this question to come up afterward saying, well, that's pretty difficult to catch that. Or a person of your age would probably take those two together. So one of the criteria for picking the drug combinations is that anybody should know this. There was consensus. And that's what helps when you work with academics. It wasn't us coming to that conclusion, and we weren't just Googling and researching. We had an academic team. So when I went to CBS and I explained what we had done, I didn't say that it was just the Chicago Tribune that did this. I said that we had this team together, involved university researchers, and here's what we did. And so when you are going to a company and say, listen, you did something really bad, it helps if you have the academic team behind you. But they also can check on the computer too. I mean, any pharmacist can just punch those drugs in a computer, and there's usually a color code will come up. Red will come up saying don't give it. But the problem was there was no typing or punching. There was just delivering. You have money, next, because they get paid by volume, right? I mean, speed is such an important thing at pharmacies. That's all they talk about. And you'll see it advertised too. No waits or in and out, that kind of thing. So because of that work, there were a lot of reforms across the country, which sort of cool, is right before I came here to Dortmund on Friday, I had to go pick up a medication for myself. When I go into the pharmacist, I see a sign there now. This is by law. It says that a pharmacist has to come out and talk to you and ask you questions, basic questions like, have you ever taken this medication before? Have you tolerated it? Are you on any other medications? this is what a pharmacist's job is for. They're not working at McDonald's. And so now by law, they have to do this, and by law there has to be a sign letting people know that this is your right. And so again, this is like the power and coolness of journalism, is that you can do a story, and then, you know, in your own personal life, they're getting your medications, and you say, oh, that's our sign, right? We help do that. That's sort of a cool thing. But again, I don't think any of that would have been possible without the input from the experts. Not just input, but true collaboration.
Just to get a better understanding, is it a pharmacist's job to double check a doctor's prescription? Maybe they thought, okay, the same doctor prescribed both pills, maybe in this case it might be okay.
Yes, it's a great question. The question is, isn't it a pharmacist's job to check on a doctor if this is the right prescription or not? If there's any question in a pharmacist's mind, their duty, their professional duty and legal responsibility is to call the doctor to ask questions. And so that was part of our criteria for pass or fail. If the pharmacist stopped and was curious about these prescriptions and called the doctor who wrote our prescriptions, then we consider that the right thing to do. We consider that a pass. So at that point, we canceled the prescriptions. They called the doctor, the prescription was automatically canceled, and we left. If they never called the doctor, if they never verbally warned us, if they never told us, you know, hey, don't take these together, that was considered a fail. So I wanted to also talk about a tremendous project that was recently completed out of Stanford, having to do with police stops and searches, looking at whether searches are done with the same amount of evidence based on race, and you could sort of probably guess where the results might be. But this was an interesting collaboration because they involved journalism students. And so if you're looking for some collaboration where you don't have to pay the journalists, you can use students, right? There may be more journalism students in America right now than actually working journalists, so why not use them, put them to work? So what they did at Stanford is they started collecting information from all the different states on police stops and searches and how much evidence they had to do that. And the engineering, then they took all this information. You can imagine if you get information from different jurisdictions, it's gonna be hard to compare. And so what they did is they had to standardize the information, and the professors at Stanford helped them with that. And then in the end, they found that Black and Hispanic drivers were searched on the basis of far less evidence than white drivers were. And again, the cool thing about this investigation is they used journalism classes, they used students. They're the ones that went out and did the data collection. They did all the writing to get all the records, they brought it back, they did some analysis, but then it took academics to really fine tune it and to bring that whole project home. And so, so I teach journalism too, and so I've been thinking, God, are there ways I could use journalism students to do the collection and maybe use other departments within the university to do collaborations and maybe assign one or two students to sort of be the project manager so I don't have to do it. Is there ways that we can get students and young people thinking along these ways too? Just lastly, challenges in these kinds of projects. Obviously money, that's a tough thing. Time, these are very time-consuming projects. Continuity, if someone leaves, we mentioned before, then you have to deal with that. Crediting, with our projects, we never really came out and said, well, are you going to give me credit, or how much credit do you want? It just sort of happened naturally. The scientists asked me if I wanted my name. They said, we would like to put your name on these scientific papers, and I said, no, it's probably not appropriate. But you know, you can put it in the acknowledgement section. Usually in scientific papers, there's an acknowledgement section, so that's what they did. In our stories, we had a methods box where we explained the methodology, and we were very clear about who we were working with and what they did and what we did. So that gets through some of those issues. But I think that best way to beat back some of these problems is just find people who are like you in the academic field. Researchers who really care about issues, who feel passionately about this kind of thing. And if you have a great idea, that is really gonna solve a lot of problems. If you have an idea that is good for journalism and for science, that's gonna make a partnership make sense. There has to be something in it for your academic partners, your scientists. I mean, they're not just there to help you, they're not gonna work for free, right? So you want an idea that is great science and great journalism, and but that's hard. I mean, what are those ideas? I think probably the best ideas are ones that there's a lot at stake. People are maybe being unnecessarily harmed, people are being hurt, there's discrimination, there's injustice, something large, something bigger than you, something bigger than the scientists, something you can hold over their head if they're not working, right? They say, I haven't had a chance to work in that. You can say, listen, Joe, there's people out there who are dying, we need to finish this, whatever. I think that really goes a long way to help deal with your partners, to deal with your bosses. If your boss is saying this is taking so long, you can always bring that up. Saying, I know it's taking so long, but this is so darn important. I mean, there are people out there who could be getting hurt. I mean, that's a compelling argument. It's hard for someone to say, well, we don't care if people are getting hurt, you have to do other stories. So I would try to find ideas if you're going to do like a big project that really where people are being harmed and you might be able to make a difference. So that's what we have. There's Sinduja at your computer at home, right? Any thoughts or questions? Here.
You can use this.
Oh, yeah. Thank you, Sam, for another inspiring talk. Thanks for coming to Germany again. I hope nobody asked that before because I was a little late. How did you solve the scientific publication issue? As you said, the scientists wanted to publish on what they had done, and you published too. So was there something like a struggle, like who should be first? And how did you solve that? Because scientists sometimes want to be first before you come next.
Yeah, we had great partners actually. We had sort of came to an agreement without much discussion that if at all possible, why not publish on the same day? Why not have it come out in the journal and we'll hold our story back and we'll publish the very day it comes out of the journal. So that's what we did. I actually had to coordinate with the editor of the journal, right? I thought to myself, God, I'm dealing with so many editors. Now editors from other publications, right? I mean, I can't get away from this. But we coordinated, they were going to come out, let's say, October 1st. So then I went back to my editors and said, we need to hold the story for another 3 weeks. And we're going to come out on that day. Because then in our story, we can link to it. We can say the scientific results were published, today in this particular journal. So that worked out really well. But, it might not always work out that way. I think you have to be flexible and be ready to move quickly or be willing to hold your story back. I think simultaneously publication would be the best thing to do.
I think for us the collaboration, was the other way around. Our story, our collaborator waited for a long time, and then the administration changed, and there were some issues in which we would have to go first and they would have to go second. It's never ideal, but then we ended up publishing together. So the goal is always to publish together. But things can happen. But I think our perspective with our academics was always that news has to happen first, if at all, because if the paper gets published, then other news journals can write about that, and then your collaboration and your work can be behind. So that was, and our academic was on board because he felt like even before the paper is published, or if there's a working paper, they would go to conferences and write about it, and then the actual paper, peer-reviewed in the journal, would come out like 2 years later, but it didn't matter, and other newspapers have already written about their work. So there was acknowledgement of how the academic world worked as opposed to the newspapers.
I'm wondering, did your scientific partners go through like ethical committees and stuff? if they published papers, they must have proven something about their ethical considerations.
Yes, at Columbia they had to go through what's called an IRB process too, so to make sure that there was no ethical problems in any of the research, so they did that. But yeah, there were two and another paper in the works that came out of our work. They were all peer reviewed. We first tried to get the work into the top journal, New England Journal of Medicine. We were rejected without comment. That was disappointing, so then we dropped down. We waited quite a while because we wanted that work on the drug interactions to be in a top journal so people could see it. And it ended up being in a top cardiology journal, and the scientists were really happy about that because the work would actually be in front of doctors, the people who would actually need to know this. Some of the other work ended up in drug safety and some data mining magazine journals, which is a little easier to get into. But again, it's a rigorous process, and they did have to address the ethical issues, as we did too. This was a constant conversation we had at the Tribune about the ethical issues of what we were doing, even the ethical issues of working with scientists. There were some people in the newsroom who thought, you're a journalist, you're not supposed to work with scientists, you're supposed to write about them, you're not supposed to actually work with them. So.
Can you kind of explain from your experience what level of academia is like the best level for a collaborator? Because I imagine if you ask professors, they have a lot of funding, like so financially it might be more stable, but a lot of times they don't have enough time, and also maybe not so familiar anymore with the latest groundwork that you could do in terms of data mining. On the other end, for instance, if you ask somebody who's a PhD candidate or something, like they have a lot of work to do. They might be very idealistic, but also given, like, for instance, that a lot of contracts just run for 2 years or something, it might end up the way, okay, you start collaborating with them in Chicago, and like by the time you actually want to publish, they, for instance, move to Arizona, and then all of a sudden you have to coordinate that as well. So what is your experience in terms of what is the level of academia that your collaborator should be ideally to?
Boy, that's an excellent question. Well, ideally, you want to work with the best. Right, because especially as an investigative reporter, you're working toward changing the world. You want to make a difference, and so in order to do that, you know you have to have confrontational interviews at the end of your work. You're going to have to go to somebody doing something bad, and explain that you found something, and what are you going to say about that? And it's better to have the best academics on your side. So my advice would be, if you have a topic and you want to collaborate, to go to the very top people in the field and ask. You may be nervous, like why would the main expert want to help me or do this with me, but they may be excited by your idea, or they'd be impressed by your boldness, and they may want to do it. If they don't, at some point you have to go with what you got, right? And so if you can't get the best experts, then go down a couple tiers. And if it's a graduate student and that's all, I would still do it, right? The worst thing to do is to do nothing, right? But you do have to remember that, especially if you're exposing wrongdoing, that you're gonna have to defend your work. Big companies like CVS or Walmart, they're not gonna sit back and take this. They're gonna fight back. They're gonna criticize you. They're gonna criticize your methodology. They're gonna question your credibility. And if you have a really strong, top-notch academic team in place, that's really gonna help you.
I think my experience has been that some of the top-notch academics don't always come from schools that are well-known or Ivy League. Although I think the academics who work in those schools are certainly very, very good. But I've been collaborating with academics who are very, very good, who are experts in their field and who don't belong to those Ivy League schools, and it's been easier to approach them.
And one tip I would say is that if you do want to collaborate with a top expert, is go visit that person in person. Don't just call on the phone or write an email, but fly to their place and set up an interview to talk to them, because that's flattering. I remember when we were here last year, and the main collaborator that I had, Nick Tatanetti, was asked, well, why would you collaborate with this guy? He goes, well, He came all the way from Chicago to see me. He sat down, I think part of it was just someone taking the time to physically visit them and make a personal appeal. I mean, it's hard to say no, especially if an expert is so much older than you, to say no to someone. Will you help me? Will you help me is a very powerful question. It's hard to say no to that, especially if you have an idea that's going to help you.
My question goes into the same direction. So, what is your overall experience of these scientist-journalist collaborations? Because in the beginning of this conference, well, our impression was, well, the journalists are more or less convinced that that would make sense, but maybe it's much more difficult to convince the scientists. So if they have a look in the scientific community, so what's my use of such a collaboration? How many scientific papers will I get? So what's your impression, your overall impression? Is it still a rather strange idea for most academics to collaborate with journalists, or is it now, well, on the way to a common idea? So both of you, please.
I mean, I think there's still a lot of work to do. I don't think it's a popular idea. I think many people are trying to do this. I think it depends on the academic. I think for me, when I've had these collaborations and the academic has been on board and has said, okay, let's do this, or I'm convinced of this idea, they've been fully on board, and it's been really great working with them. Certainly, I've definitely met academics who are not convinced about this idea, who are skeptical of journalists, who think all journalists are the same, that they would take your research and make it seem very sensational and lose the nuance. And I think they're right to some extent, and they need to know that all journalists are not the same, and that there are different types and of newsrooms, of journalism, and they need to find the right way to do it. And I think there's a lot of work to be done. I think your observation is absolutely right, but I also think the needle is moving.
The needle is moving. It's going to get easier because every time we do a project like this, it's going to help us sell the next project. So even if it's not your project, you can go to a top expert and say, listen, a colleague of mine did this, this, and this. I have this idea. I would like to do something similar. This is a new movement in journalism to work together. Would you consider this? And if they say no, saying, okay, I'll be back next week and ask again in person and try to charm you into doing this, and just keep trying. But I do think that the more we do this, the more acceptable it's going to be. We talk about it in journalism circles, but I think most scientists have never heard of such a thing, right? And so that's a big challenge. You know, there's probably more in it for us than it is in it for them. So we have to convince scientists that, yes, we're going to do some great journalism here, but it's also going to be great science for you too.
On the other hand, I've met so many academics who are brilliant. Their work is, in the academic circles, amazing and the best piece of research on a subject, and nobody's talking about it because they haven't received enough coverage. And they're really good academics from top schools. So I think there's a lot of scope, and I think conferences like this are so important because you're bringing those academics, you're bringing these journalists, you're showing what's possible, and then you're making the conversations happen. And so there's at least exposure and conversation and discussion around it.
And many top scientists are media savvy. They do interviews, they're on the radio, they write for general interest publications. And I think, almost paradoxically, the top scientists may be more open to doing this than some others.
The honor is with me. Thank you very much. Sam, it's a great pleasure to have you back after last year's presentation. I thoroughly enjoyed this year's presentation as well. Of course, Sinduja's as well. Last year, I remember, Sam, you saying that you were looking for the next story, which is, of course, achieving a huge benchmark after you were awarded the Pulitzer. I believe for this story.
Actually, I was a finalist. The Pulitzer was years ago when I was young.
Yeah. So it's a big benchmark.
Yeah.
So your search for a new story and cooperation has that led to some new results. First part of the question. The second, I do also remember you saying that you were interested in international cooperation, maybe looking into the global south, developing countries, and as well into the medical field. So 2 parts of one question, and again, thank you very much.
Thank you. It's good to see you again, obviously. Monica, yeah, last year when we were here, we had a panel to try to do a global project on this mysterious kidney ailment disease that was killing people around the world, especially along the equator. And we were trying to maybe get some support among journalists like yourselves and academics to get the ball moving on that. We got a little bit down the road and we applied for a grant with Dr. Lee Newman from the University of Colorado. You may have met if you were here last year, and the grant was denied. And so we're sort of in a holding pattern on that, but that's still a fantastic idea. And just because something doesn't work out that year doesn't mean you shouldn't do it or shouldn't pursue it. Some of these ideas are years, as you know, are years and years in advance. Your best ideas are in the back of the head that won't go away. You keep thinking about it like an old flame. You just can't get it out of your mind, right? So you come back to it. So the other part of your question, I'm actually working on something right now where I'm collaborating with some experts and some people who do testing in laboratories in the United States. It's going to be done fairly soon. My bosses guarantee that it'll be done soon. They tell me it better be done soon. It's expensive. The problem I'm running into is money now. Our company doesn't make as much money as it used to, so I'm struggling to find financing, creative financing. So I'm, for the first time as a journalist, I find myself thinking about how to fund my projects beside having a newspaper pay for them. Like the projects I just showed you up there, those are very, very expensive stories, right? Probably, you know, hundreds of thousands of dollars a piece to do those. They don't have that kind of money now to do that. And so I'm trying to finish the story. I need some money, so I'm looking for collaborators actually within the media industry. You know, other media outlets that I can go to. I'm halfway done. I've got these great findings. Why don't we collaborate? You can get half credit, but I need some money to help finish it. So that's where I'm at on that. Hopefully it'll be done by the end of the year.
Okay. I think we need to close the session now. We have to break, and then at 12 the next session starts.
Thank you.
Thank you so much.